Hello everyone. In today's video, we are going to discuss about the importance of Kaal. Kaal, it is also known as the Parinam. It is one of the 9 Karan Dravyas and it is given appropriate importance in Ayurveda in various aspects. It is also considered as the Amrit Karan Dravya. Kaal can be considered as a change and it is the only one but many for the different presentations and the calculations. It is expressed as day, month, etc. Kaal is said to be Bhagwan, Swayambhu, that is self-originated, and its origin, existence, and end are obscure. It is that which controls both the life and death of an individual. It is a continuous process like Chakra which does not stop even for a moment and joins both Sukh and Dukh to the life of the individual. Importance of Kaal in Ayurveda. Classification of Vyadhi. Kalaj and Akalaj Vyadhi. Kalaj Vyadhi can be connected to the growth of the body and the state of the organs. As the time passes, the bodily changes are observed like graying of hairs, wrinkles on the skin, etc., which cannot be reversed by medicine. Akalaj Vyadhi are the diseases which occur untimely. For example, the disease which occur in Yuva Avastha. Kaal as a Nidan for Yoga. The Ati Yog, Ayog and Mithya Yog of Earth, Karma and Kaal is considered as the three main causes for the manifestation of the diseases. If a particular season is manifested itself excessively, it should be regarded as Ati Yog, less manifested as Ayog, and exhibition in contrary to the normal one can be considered as Mithya Yog. Kaal in embryonic life. The concept of Kaal is explained in Garbhavakya Sharira by Acharya Sushrut, which discusses the embryonic life of a fetus. The development of fetus during gestation is time specific, with the development of the manas at the 5th month and the buddhi at the 6th month. Kaal with reference to Kriya Kaal. The concept of Kriya Kaal has been described in two separate entities, Ritu Kriya Kaal and the Vyadhi Kriya Kaal. The chart depicts the relationship between the Ritu and Dosha as to the Chay, Prakop and the Prashamna. Ritu Kriya Kaal explains the normal physiological variations of Dosh in respect to the season. Vyadhi Kriya Kaal explained by Sushrut gives an idea about the consecutive stages of the disease. They are Chay, Prakop, Prasar, Sthan Sanchray, Vyakti and Bhed. By understanding the stages of the disease, early diagnosis of the Vyadhi is possible and this helps to cure the disease successfully without much discomfort in planning the treatment. Importance of Kaal in Arista, that is bad prognosis. Acharya Charak has explained the Arist Lakshanas which indicates the death of an individual in a specific period of time. For example, if there is diminution of body heat, absence of concentration of mind, loss of complexion, weakness of mind, and absence of attachments toward life indicates that the death of a person in 1 year. Role of Kaal in understanding physiology. Many physiological functions in the body are bound to specific Kaal. For example, attainment of puberty at around 13 years and menopause at around 50 years in females, 21 to 35 days of menstrual cycle and 37 and 40 weeks of gestation. Heart rate 70 to 80 per minute, respiratory rate 18 per minute, urine output which is 1.5 to 2 liters a day and other essential vitals are measured in terms of Kaal. Importance of Kaal in collection of drugs. According to the part used, there is specific time for the collection of each drug. Mool, which is the root, is advised to be collected in the Grishma and the Shishir Ritu, Palasha and Shakha in the Varsha and Vasant Ritu, Tvak, Kand and Shira, the Bark and Sar in the Hemant Ritu. Aushad Sevan Kaal, the specific time mentioned for the intake of medicine depending on the dosha in a world is Aushad Sevan Kaal. They are abhakt, that is empty stomach, and it is suggested for the disorders in Vyanvata. Prabhakt just prior to the meal and it is indicated for the Apan Vat disorders. Madhya Bhakt, middle of meals, and it is indicated for Saman Vat. Adho Bhakt, soon after meals, and indicated for disorders of Udan Vata. Sama Bhakt, along with food, which is helpful in Dipan and Pachan. Antara Bhakt, after digestion of morning food. Samugd, that is before and after meals. Sagrasa, with each morsel, which is useful in Pran Vad disorders. Grasantara, that is between the morsels. Role of Kal in Chikitsa. Treatment of a disease depends upon the knowledge of certain factors, and Kal is one of among them, without which complete cure of the disease is not possible. The physician should consider the three times, past, present and future, by proper adaptation of planning. Dant Dhavan, it is to be done twice daily in the morning and evening. Snan and Sandhya should take bath and worship twice a day. Dhumapan, Acharya Charak has mentioned 8 Dhumapan Kalas that are advised to be done after bath: consumption of food, emesis, sneezing, washing teeth, nasal snuffing, anjana, and rising from bed. If same is done in appropriate kal, it leads to deafness, blindness, loss of speech. One should inhale Anutel every year during the 3 seasons, the Vasant Ritu, Shishir Ritu and the Varsha Ritu, when the sky is free from cloud. Shelf life of Ayurvedic preparation. Churn, herbal powder mix that is for 2 years. This applies in the churn jar is kept in airtight closed container. As a general rule, once opened, the churn jar should be finished within 2 to 4 months. Modern packaging techniques can extend the shelf life of churn for 2 years. According to Ayurvedic text, Vati, Gutika or Kashayam tablets prepared from the herbal and mineral ingredients, have a date of 5 years of manufacturing. Loha, that is the iron containing Ayurvedic medicine, have a shelf life of 10 years. Good, that is jaggery based herbal jams, 3 years from the date of manufacturing. These are some images that depict the shelf life of different Ayurvedic formulations. Next, we have the effect of Kal on Grit. According to Ayurveda, Grit improves with age and its healing properties become more potent as it ages. Purana Grit, that is 10 years old, cures intoxication, epilepsy, fainting, head, ear and eye disorders, and vaginal disorders. It also cleans and heals the ulcers. Old ghee consists of all the properties of fresh ghee along with special qualities. Hence it is similar to nectar.